Hello people, hey guys, welcome to my YouTube channel. I still remain your girl, pharmacist Nafisat Suleiman. I know a lot of women, especially the ones in their childbearing age, have battled vaginal yeast infection at some point, and they have questions they've been seeking answers to about vaginal yeast infection. If you are one of these women, please let me know your questions in my comment section, as today we will be discussing vaginal yeast infections, the symptoms, the causes, the prevention, as well as the treatment of recurrent vaginal candidiasis. So what is vaginal yeast infection? Vaginal yeast infection is an infection that occurs when too much yeast grows in the vagina and causes irritation to the surrounding tissue. Although some bacteria reside in the vagina, not all bacteria are harmful. Some are important to maintain the normal flora of the vagina. What are the symptoms of vaginal yeast infection? Most women that have vaginal yeast infection usually experience itching of the vagina and the vulva, abnormal discharge which is usually thick, white and cuddy, burning sensation during urination, swelling of the vagina, as well as pain during sexual intercourse. What are the causes of vaginal yeast infection? Vaginal yeast infection usually occur in women who are pregnant, using oral contraceptives, or also taking antibiotics, especially the oral antibiotics, women who have diabetes, or have a weakened immune system. Antibiotics tend to kill the bacteria that usually prevents vaginal yeast infection and then increases a person's risk of developing vaginal yeast infection. Sugar fuels the yeast growth, so diabetes that is not well controlled can make you prone to vaginal yeast infection. Women who are pregnant are also prone to vaginal yeast infection due to hormonal changes like estrogen release. These hormonal changes lead to increase in pH of the vagina, and the pH of the vagina is usually between 3.5 to 5.8, which is acidic and low. So an increase in this pH can support the growth of yeast. How can we prevent vaginal yeast infection? Here are some of the things you might be doing that is making your yeast infection to reoccur. 1. You wear nylon underwear or synthetic fibers. Don't. Always wear cotton underwear. Yeast thrive in damp environments, so a cotton underwear which absorbs moisture is a smarter choice. 2. You practice douching. Douching is the washing of the vagina with a mixture of fluid and soap. Don't. Douching does not necessarily eliminate only harmful bacteria, it also flushes out both the good and bad bacteria and make you prone to vaginal yeast infection. 3. You use scented tampons or pads and then you scent your underwears with female deodorants and you wear tight-fitting clothing. That's a no-no. 4. You don't get out of damp clothes as soon as possible after going for a swim. Instead, you sit around in these wet clothes and this makes you prone to yeast infections. And lastly, you might do this mistakenly. You wash your vagina from back to front. Always wash from front to back. Washing from back to front can spread the bacteria from your anus into your vagina. Always practice good feminine hygiene. After taking your bath, ensure to dry your genitals and get rid of any lingering moisture. How can we treat vaginal yeast infections? Apart from drug therapy, there are also home remedies for treatment of vaginal yeast infection. The first approach to treatment of vaginal yeast infection by drug therapy is the use of antibiotics. Antifungal medications like fluconazole, which can be taken 200 mg weekly for up to 3 months, can be very effective, and also the use of tablets and suppositories containing miconazole, also known as Monistat, can be effective. This Monistat comes in 3 strengths: 1, 3 and 7, 1 being the highest and 7 being the lowest. 7 is preferable for pregnant women. And also using pessaries. Pessaries, these are medicaments that are formulated to be inserted into the vagina. Using pessaries containing clotrimazole, metronidazole and lactobacillus spores can also be effective. Vaginal yeast infection is said to be recurrent if it occurs up to 3 times in 12 months. It is said to be recurrent. Boric acid plus antibiotic therapy can be useful in treatment of recurrent vaginal yeast infections. This boric acid is preferable to be used as suppositories, not orally, and should be prevented in pregnant women and also kept out of reach of children. Thank you guys for listening. I hope you learned something from my video. If you did learn something, don't forget to like, subscribe to my channel for more information on the home remedies for treatment of vaginal yeast infection. Bye guys.